All right, sir. So this is just where they're at. We're at.
I understand.
They found. I guess they found something. On
Yeah,
Newburgh Green,
and
right?
I was like 5 hours after I was in the bathroom.
Okay. It may have been yours in there.
It wasn't mine, man.
Okay. So I'm not trying to give you a hard time.
I understand that. I understand that.
We just, while you're here, we have to make sure that you're safe. So all I'm asking.
Yeah, but if I got
just,
wanted up there, then how?
Yeah, but you came here and they missed. I'm be honest, I'm not the best, and they missed stuff all the time. So our only concern is just that you're safe while you're here. So I'm just asking. I don't need to pat you down or anything. I just need to see the inside. Like you can show me inside
Yeah,
the
I'm not.
box, man.
No, I'm not letting you violate my rights, man.
Okay. So then you're gonna have to leave, or we're gonna have to search.
Then you're gonna have to make me leave, then. So you can't violate my rights, man, just because you guys feel like you don't know your job. You already did it. You already did. What matter of fact, you already did by going through my bag. You already violated my rights going through the bag. Yes, I did. Yes, you did, man.
If that's the case, then we violate. If we violate,
you do.
Thousands of people.
You do. That's how the cops are. You do. If they knew their rights, they would be suing the shit out of you. You do. You violate every person you search. You violate their rights, man.
You're gonna have to take that for a legal department.
You gonna have to, because you don't want to be getting sued.
So
I need your card or something, or your name wrote
Actually, a
down,
hospital
please.
policy.
So where we're at right now is you have to let us check your pockets, or they're gonna discharge you.
Okay, then discharge me.
You're gonna leave.
That's who you are, a super fucking dumbass cop that don't know his job. They're going to tell me, and I see you kicked out because you want to violate their rights. That's on you. You know how bad it's going to look, dude?
So
I'm about to sue the shit out of
Here's
you.
the other side of it.
I'm about to
If
sue
you
the
do have
fuck.
something in your pockets, right? If you do have something in your pockets and you overdose,
It's
that's on
not-
us because we
I understand that. Overdose on
So
what?
what we're asking is that you just show us that you don't have anything.
The
in
thing
your
is,
pockets.
I don't have to.
You do.
I don't have to.
You do.
Just because you think you know, you don't even know what the fucking First Amendment is, man. You don't know shit about your job. I guarantee none of you guys can give what the First Amendment is. You can't say nothing about. You can't give the 5 elements of something you swore to uphold. You're supposed to be upholding my rights. You don't even know what the fuck they even are.
Fourth Amendment we're concerned with, so you're confused about your amendment.
Excuse me? I just said the 5 elements. You're confused, dude. You don't know the law better than me. I'll let you know that. Fourth Amendment is about searches and seizures. I'm just saying in general, about knowing all 5 elements is what I meant. He don't know any of them. Told me he's gonna kick me out because I asked you because he wanted to search my pocket so bad. He already violated my rights to do it in the bag. I'm gonna see the shit out of this dude and have a realization what the fuck is going on in life. You guys violate people's rights. If you guys search people going through this all the time, you violated hundreds of thousands of people's rights.
You forfeit your right to sue.
No, you do not. You think the Constitution?
Sir, I know you don't see it now, but...
Hold on, man. Please say something. You think the Constitution goes out the window because you come on private property? Are you fucking insane?
This is a private business.
Are you insane?
Private business.
Dude, you don't know. Google on your phone right now, man. For you say some shit. That's the people's constitutional rights just go out the window because you're going for.
It makes a difference because we are private property.
No, it does not. You guys do not know what you're talking about at all. At all.
The rules are here for your safety. Whether you
Man, that's not the point, though. My point is I'm not letting him violate rights because he's got some fucking ego talking about we do 100,000 to people.
You have 2 options, though, and
It doesn't matter. I told you, then discharge me. Then you guys are going to be the people to send somebody in the ICU out in the streets because you can't let your ego.
Because you could just do a simple thing, and you can be here for your health.
You're not here for my health. You're here to check my pockets. No, but I don't have
It should be
nothing
so simple. If you don't have anything, why can't you show us?
because I don't have to. There's a constitutional right not
I get that you're
to.
protecting- You think you're protecting your rights, but why are you
What?
protecting
What do
your
you
health?
mean?
You should be protecting your health first.
What I mean, no, because I'm tired of cops overstepping their boundaries. It's happened to me my whole life. Oh, my whole life it's happened to me. People like him violating my rights.
I'm sorry you think that way.
Think that way, that's what happened. How can I think that way if that's what happened to me? And they got people that back it up, don't even know what the hell I'm talking about. Not one of you guys can give all 5 elements of the First Amendment.
I can be the first thing that I can. So
Right. And that's sad. You guys are supposed to be cops and upholding shit. You get
I'm not a cop, though. So.
I know, but I'm talking about these guys. They can't. That's sad. They took an oath to uphold these rights. They don't know what the hell they're even talking about.
The point is, you're gonna choose. You're gonna choose a choice for your rights rather than your health.
No, you guys are.
The thing is,
You guys are.
we're following policy.
You guys want to violate my rights instead of letting me get better. You guys are. And I'm going to sue each and every fucking one of you. Promise you that. And I got the best. I can't. I need some free money. I need some money.
We're probably going to either. What card? What different card?
This is sad. You guys really have mental issues.
Sorry to disappoint you.
Yeah. It's not about disappointing me. All right. Hi, ma'am.
Mr. Higgins?
Yes, ma'am.
Hi, I'm Dr. Cohen. I'm one of the ICU doctors.
Yes, ma'am.
Okay, I hear that not wanting to be searched. Is that right?
No, the problem is that it's my constitutional right not to, and he thinks because I came on some private property, my constitutional rights just go out the window.
Okay, so it's not about a property issue or constitutional rights.
Yes, it is.
While
For me,
you're
it
in the
is.
hospital, for the safety of you, for the safety of our nurses and other patients,
But I've already been
we
searched at
search
the other
everybody.
hospital.
Everybody that comes here, we do it
Yeah,
again.
no, you don't.
We do.
No, you don't.
We do.
No.
Okay, and that's what we've been trying to explain.
No, you
I understand your frustration, and I apologize for that.
Yeah,
but it's just about keeping you and everybody else safe.
Yeah, that's not what it's about, man.
So-
Keep it real.
It is, 100%. It's not about violating your rights. It's not
It's
that
about
we
a
like
cop
to
that
do
don't
that.
know his job and thinks he can come search somebody whenever he feels like it. That's not happening. He already searched my bag. He already violated my rights, and I'm going to sue him when I get out for this.
He has
So-
the right to search your bag
No,
while
he
you're
does.
admitted here. Yes,
No, he does. So you think my constitutional rights go out the window because I come on hospital property?
Never said that, sir.
That's what you just said.
Never said that, sir. My job
Yes.
as a doctor is to treat you while you're in the
I
hospital.
understand. Right.
So if you don't want to comply with our rules and regulations
And do
here,
what you got to do.
well, then part of that would be you not being treated here.
If you guys want to beat up the type of people and violate people's rights because of a cop that don't know what the fuck he's talking about, then go ahead. Be in the lawsuit.
Okay, sir.
You
How
guys-
are you
I
feeling
can-
since you came here?
I was feeling pretty decent until you got to this bullshit happened.
All right.
People start playing fucking games with people's fucking.
So I heard that you were in the hospital about a week ago. Is that right? You were
Yes,
at
ma'am.
Barberton.
Yes, ma'am.
Okay. You got some antibiotics for some pneumonia. You were feeling better, and then what happened?
Then he said he was going to send antibiotics over to the CVS and they never got sent.
Okay. So you were supposed
So-
to take more, and then they just never got
Yeah,
sent.
they never got
over.
sent. Yeah, so I waited like 3 days. I was like, damn. I called the one. Excuse me. She called me and set the appointment up for. Well, yes, it was for yesterday.
With the lung doctor.
Yeah, with one pulmonary doctor.
Yeah.
And then when I went in there, she came in the room. She's like, "Oh, whoa, yeah, you need to go back to the hospital."
Okay. You were feeling real short of breath. And all
Yeah,
that.
and I was
Okay.
sweating like
Were you
profusely.
coughing a lot?
No, I've never had a cough through
Okay.
any of this.
Okay. Nothing coming up at all.
No phlegm or
Any
nothing.
congestion?
No. What's weird was
Yeah.
not in any of the episodes I've had over the last 6 months have I had that happen.
Okay. Were you dizzy or lightheaded at all?
No.
Any chest pain or discomfort?
Chest pain, yeah.
Okay.
Like
When did
when I-
that start?
The whole time, really, like when I breathed in, you could feel the top of my lung where, like, the only reason I know what it was because that's what happened. I had it in January in my left lung,
Okay.
and when I breathed
So this
in,
has been an issue for you before.
yeah, it went
Okay.
from lung to lung.
Okay. Do you smoke?
Yes,
How much?
usually about a pack a day. But since this is happening, I had that same pack, whatever it was, for about
Okay.
about 5 or 6 days now.
Okay. So you've cut down a little.
Because as soon as I hit it, it was like gonna
Oh yeah,
fall.
it makes it way worse. I'm
And it
sure.
even tastes like crap.
Yeah. Do you vape at all?
No, never.
Okay. Any alcohol?
No.
Okay. Drug use at all?
Yes, I have.
Okay.
But
in the
I'm
past?
on methadone, though. So,
Okay. Who do you get that from?
What do you mean methadone?
Yeah.
Akron Treatment Services in Barberton.
Okay.
They gave it to me. The hospital where I was.
Yeah, I saw you
Give
got
me
it
my
there.
drink,
Yeah. Okay. Perfect. All right. Any nausea, vomiting?
No, I did vomit, but that was like a couple of days ago. But it was just
Okay.
one time, and then
Okay. But nothing real consistent.
No, not at all.
Okay.
Uh-uh.
Any diarrhea or constipation?
no.
Okay. Good.
The only way I had diarrhea is when I was getting all these antibiotics going through me.
Yeah,
and then-
sure. Okay, and the last time you were in the hospital, did they discharge you? Or did
Well, see,
you
this is what
decide to
happened.
leave?
This would happen.
Okay.
I was about to have like a panic attack. I'm
Okay.
like, I'm not feeling good. The doctor came and see me probably like a few hours before that.
Mm-hmm.
He said, I'm going to send you home with like 14 days of antibiotics when you get out of here. I'm like, all right, that's cool. So then I felt like I was going to have a panic attack or something. And so I was like, ma'am, I'm about to go like just walk outside real quick and I'll come right back in. You know what I mean? She's like, well, can you wait 25 minutes? The doctor's going to come to see you. I'm like, ma'am, please,
okay.
I'll come right back in. I promise you. So I went outside. She sent the security guard out to me.
Oh, okay.
The security guard said, It's okay. I went out and smoked a cigarette. Is what I did. Tried to calm down. So okay, you're fine. You're smoking. Just make sure you go back upstairs. I'm like, yeah, I'm going back up there. Then like 2 seconds later, just come back like, hey, they said they want you to go back through emergency to get admitted. I'm like, damn. I'm like, that sucks. Like,
Yeah, that's weird.
so then I had to just end up calling for a ride.
Okay, all right.
But I thought he was going to send the antibiotics because he already like told me that he was. You know
Got
what I
it.
mean?
Okay, gotcha.
And that was the end of that stay at Barberton.
All right. I'm gonna sit you up, okay?
Okay, that's
I'm
fine.
gonna listen to your lungs. All right. So I think we're looking at a case of incomplete treatment of pneumonia, not necessarily.
That's
not
probably
necessarily
that is.
failure.
Yeah.
So I'm going to test you for a whole bunch of stuff. We're going to swab your nose to look for something called MRSA. We're
Okay.
going to also test your urine for some antigens.
I've been
Basically-
trying. I tried to pee last time
Okay.
I went to the hospital.
Yeah,
I
just
didn't.
whenever you can.
I couldn't get it
You've
out.
got quite a bit of fluid, so I wouldn't be
Yeah.
surprised if you have to pee soon. But
Yeah, I couldn't get it out.
can you lean forward for me?
Yes, ma'am.
Okay, nice deep breaths, as deep as you can. Okay, you can lay back.
Okay.
Keep taking some nice deep breaths. Good.
That's all I can get. Sorry.
No, you're fine. Enough for me to listen. You don't sound too terrible, so that's good. I think the main reason why you ended up with me here is because your blood pressure was a little low. Does that sound right?
Yeah, it never has been before. When I do this 6-month process, I've been going through.
Yeah, we can see that sometimes you can breathe normally.
Okay.
When people get real sick, their blood pressure gets low.
Like, what could we calling this? Like the
So it's probably the
jump from lung
pneumonia.
to lung? No, yeah, I mean just
Lung
like.
to lung is weird.
Be able to switch hands straight now.
Yes.
Usually, it doesn't jump from side to side unless you're what's called immunocompromised or you have some condition that's lowering your immunity. I'm not sure what exactly that would be.
Could there be something in the house that's causing it?
It could be. Do you live in an older house?
Yeah, a 100-year-old house.
Okay. Is there mold in the house?
Not that. No, that's my uncle looked for that. But no, there's no mold.
Okay. Lead paint?
I don't think so, but it could be possible.
Yeah, with a house that old, I wouldn't be surprised. Hi, Dr. Cucci. That's my boss.
Oh, what'd you say his name was?
Dr. Cucci.
That's what I
C-U-C-C-I.
thought you said.
Yeah, he's Italian. Any leg swelling you've noticed?
No.
Okay. Any fever or chills while you were at home?
Yes, I was fighting the fever like the last 3-4 days, or
Okay.
no, not about 2 days. I was taking Tylenol and like NyQuil, severe flavor,
Yeah.
which would make me get a little bit better and be able to fall asleep.
Right.
And I wake up shivering, shaking, and
Okay.
but
Did you take your temperature at all? Like, do you have a thermometer, or it was just...
Yeah, it was 101.9 or 101.9.
Okay.
Then it was like 101.1.
Okay.
And that was because I take care of my 98-year-old grandmother. And she lives across the street from me. She has her thing. And I went over there and did that. And then, but the third time I just said, I got to go to the hospital because I went to a doctor's appointment.
Yeah.
It was just, I don't know.
Okay.
I just don't know what the hell I did to be like this sick.
Well, I don't think it's necessarily anything that you did, other than maybe a lack of
Or like-
communication on the healthcare
Right.
part. Let me see if we can get your blood pressure here.
Because I've never been, I'm like 45 and I've never been sick. I've never been in the
You can just
hospital.
set it there and we'll keep going.
I just never been in the hospital before being sick like this ever.
Yeah.
You know what I mean? I've had like a cold or flu before, and I took some of that stuff and it went away in a couple days.
Yeah. And I saw hepatitis C. You're getting treatment for that. Is that
Yeah,
correct?
but I stopped because
Okay.
the lady told me not to take it with the antibiotics I wasn't taking.
Okay,
So
yeah.
then I quit taking it.
Yeah, it's fine to pause it
Yeah.
for now. So we won't continue it while you're
Yeah,
here
because
either.
and the lady's mad. This lady, she's so nice, and she's like super pissed off at me. And I'm like, I told you
Aw.
to take it. I'm like,
Gotcha.
yeah,
Just trying to see what his blood pressure is.
that's fine. This motherfucker's tight.
It does, yeah. Yeah, it's got to be accurate. Especially because that's the only reason you're with us in the ICU and not on a regular floor.
I understand.
Yeah.
I never had to happen before.
Hey, Mike, what's going on, dude?
Not much, man. Just not trying to get better, and they're worried about stitching my socks.
Yeah, so I think the concern is, so overall, it sounds like when you went to the emergency room,
Yeah.
what was the reason you went to the emergency room in Green?
And what today? You mean recently?
Yeah.
Because I got pneumonia in my lung.
Okay. So you have pneumonia, and I think you were recently in the hospital before, and you left early, and they weren't able to give you antibiotics. So I think that's what's kind of going on. It's like catching up to you.
Like what happened? Seriously, what happened? I left early, but what happened was the doctor came and said he's going to give me about 14 days of antibiotics.
Yeah.
And I said, okay, cool. You know what I mean?
Yeah.
Well, in the meantime, like I felt like I was about to have a panic attack for some reason. Like I just couldn't catch my breath.
Do you think you were withdrawing?
No, I was about to have a panic attack.
Yeah.
I couldn't. Like I was losing my breath.
Yeah.
So and the nurse lady, I said, I'm gonna walk outside real quick, but just give me. She's like, well, can you wait like 25 minutes? I'm like, man, I can't. I just need to get out this. I need to move out this room. I've been in this room for 4 days. So I went outside. I sat on the bench. I smoked a cigarette. The security guard came out and said, "Are you coming back upstairs?" I said, "Yeah, of course I am. I just need to get a few minutes out here." And then 3 minutes later, she comes back out and says, "They want you to go through emergency and get reprocessed." I'm like, okay. So I just went upstairs and got my stuff and I left.
Yeah.
Because I didn't know I didn't know you weren't allowed to leave the room like you were a prisoner.
That's frustrating.
Yeah.
So, irrespective, I think you need antibiotics. I think you need to be in the hospital. You're on.
No, I
oxygen.
understand. Right.
So it is our policy that we have to make sure that we search all patients.
You're gonna get sued if you do it, man.
There is no lawsuit
Dude,
involved.
you think constitutional rights go out the window because you come to a hospital?
No, but your health is.
Do you think constitutional rights go out the window because you come to an hospital?
In a way, your health is our responsibility.
Yeah, but constitutional rights don't just disappear because of my health.
So, if
I'm not letting you guys do it. Period. Point blank. And if you do it, he already searched my bag. I want his name and stuff because he's already getting sued. So you can't just search people's shit because you feel like it. He did it all some sneaky ass way. Like, let me see his bag, and ran over there and checked my
no,
side.
I think he's doing his job.
That's not his job. He can't violate people's rights. He took an oath to uphold these rights, and he didn't do it.
Sir, we do it to everyone every single
Then
time.
you violate the rights every time, sir.
It's private property.
Dude, that
Signage,
doesn't matter.
signage on the doors.
Dude, that sign doesn't mean shit. You think that sign overrides the Constitution? Honestly, be logical. Be logical. You think that overrides the Constitution?
So we can't keep going back and forth.
Yeah.
I'm trying to ask you a question.
So, sir,
Because you can't answer the question. That's
no,
why.
I think he did answer the question.
No, he didn't. He said, talk to the doctor. Just like a fucking cop would say.
So it is our right to search you because we are responsible for the health and safety.
You guys are
of
delusional,
and the
man.
health and safety of yourself.
Okay, go take your phone, sir, and go look it up, and then come back and tell me that.
Okay.
I'm not trying to be a dick to none of you guys at all. I promise you, I'm not. But I'm not trying because I'm tired of cops like this override and trying to think they can do whatever they want and violate people's rights. When I got my rights violated so many times I didn't even know it. When I got to reading and watching videos and learning about my rights, these motherfuckers violate my rights every time I ran into them, and I didn't even know what was happening. So now I'm adamant about it. I'm not doing it no more. They're not violating my rights no more. I don't care what you do. Send me home and I'll fucking roll down the road and go home. That's it. If you guys feel searching me is better than my health, then you guys are all pieces of shit.
They're one and the same. They're one and the same.
What is?
Searching you and your person.
So searching me is
managing your health.
Searching me is. Are you serious? You just said that?
Yes.
That's sad.
I'm sorry.
Yeah, you are. That is the saddest shit I ever heard in my life. Somebody say that searching me is the same thing as my health.
It's something that
man, just quit talking to me, man.
When all patients show up to the hospital,
and I was searched.
Gets searched.
And I was.
Where were you searched?
The last place I went to. When I came to the door, what did I do? All of a sudden, shit out of a damn gun. Sad. You guys, look at this. It's sad, man.
Do you have any verification of that or not?
No, so they wouldn't let him.
They don't come through the door. They got a big.
There, you got that in policy.
And they start here.
Would you say I did the same thing there?
Yeah.
You're a fucking liar, man.
Okay.
You're a fucking liar.
Yep.
They got a fucking big machine that you go through, and you go through and come and wind you. That shit, this didn't happen to you. See, you're just like a fucking pig, man. Just a fat out fucking liar. What?
Are you worried about getting charged? Is that
Yeah, is it because
Worried about getting charged?
You won't get charged if you find something.
What are you talking about? Charged about from what?
I'm just wondering why you don't want to be searched.
Because I believe in my constitutional rights. And people like cops don't give a fuck. They took an oath.
It's not a problem.
Ma'am, constitutional, that's what a cop says. If you do nothing wrong, what does it matter? It's constitutional rights for a reason. I don't have to do it. That's the problem. I don't have to. These dudes took an oath up to, and they can't even do the 5 elements of the First Amendment. They can't even tell you at all. And that is sad. This is their job, and they can't give you the first, the First Amendment, just the first one. What's the 5 elements for the First Amendment? Hello? Right. You can't even tell me. That is sad, dude. That's like going job at Burger King. Like, what's going to get a Whopper? Well, what's a Whopper? I don't know what that is. That's fucking pathetic, man. Tired of this. I'm not going for it. You guys want to kick me out here like this? That's the type of people you are. Do what you got to do, man. He just sat there, just lied right to your fucking face and said, this happened at the other hospital. Fucking flat out liar. You did not, that shit did not happen. You know it didn't happen. Yeah, that's why you can't even look at me and you're saying it, because you know it didn't happen.
There's a report already generated.
There's no, don't let me see it then.
Oh, I don't have it.
Oh, okay, yeah, you don't have, you're right.
Go through our legal department.
Right, yeah, you're right. It's just something what a pig would say. You can tell me fine. You heard this shit? Come on, man.
So the concern is when you went to the bathroom or something at Green, you came back and they advised that you were acting not the same. So they were concerned that you might have had.
It was acting out not the same. I came back and went to sleep.
They said that they were just concerned might have been some drug usage. That's all we care about. Is if you don't have drugs on you, so you don't overdose in our care because we're liable.
I understand that.
That's all. This is all this.
So if you understand, won't you just let us see your copy?
Because I don't have to. Why can't cops understand that? I don't have to.
Well, they're probably not going to see you as a patient.
I don't care. If that's what you want to do, go ahead and go sleep on that yourself. You don't care because you violate people's rights. You said you violated people's rights hundreds of thousands of times. You should have been long gone fired, but you will be when you get done out of here.
Apparently, according to you, the whole Cleveland Clinic violates people's rights.
Yeah, they do.
Alright, Michael, so all we can do, especially me as a doctor, okay?
Yes, ma'am.
All I can recommend is I want you here.
I know. I want to be
I
here
want
too.
you to be treated.
I want to be-
want you to
yes.
stay in the hospital.
I do too.
And I understand your concerns about your rights and all of that.
It's because people like this are.
I know. And we've explained to you what our policy
You
is.
just flat out lied. Said
I
this
know.
happened over there. It
We've
didn't
explained
happen.
to you what our policy is. It happens every single day. Patients consent to this. They have their pockets turned out, and that's we
you're
go about our
violating
day and
you're
we treat
violating
them.
people's rights, ma'am.
It's so that we can treat our patients safely.
I understand,
What
but you're
all I'm trying to say is that if we do that, we keep you here, we get you treated, we get you on your merry way, you're getting better.
I understand.
If we don't do that, which again, it's your right to refuse that. It's your right.
I don't want to refuse that.
Just let me finish, okay?
I'm saying I still want to
I
refuse
know,
that though.
I know. It's your right to refuse to be searched. It's also your right to refuse treatment. And
I don't want to
if you
refuse
don't comply with
treatment.
our policies, we can't treat
If
you.
that's what you guys
fully.
want to do to me, that's on you.
It's not entirely on us, is the thing, Michael.
Yes, it is, because you're violating my rights searching me, man.
I do think it's worth your health.
You're violating my rights searching me. If he wouldn't came here today,
If you think it's
if
worth
he-
your
if-
health and potentially your life,
Would you allow me
that's
to
up
search
to
you?
you.
So hey Mike, based on all the information I have, I want to respect your rights, right? So my rights, based on what I know and based on the information I have rights for your health and I have rights for the health of everyone in this hospital.
I understand.
So your rights, which I want to protect, is either one of two things. One is you stay here and get medical treatment.
That's
in
what I
order
want.
to do that,
That's what I
you
want.
meet criteria that you have to have a mandatory search.
You can't violate
Yes,
your
I
rights
can.
and do it. No, you.
Yes, I can.
No, you can't.
Yes, I can. So the legal aspect of our policy, so the legal policy of our hospital is no one is allowed to search you unless there is behavioral issues, suspicion for use of drugs, suspicion for concerns of other safety. So check, and
So
check.
how is there suspicion that they found something 5 hours later in the bathroom?
Behavioral issues and history of drug use. I'm allowed to
Behavioral
ask
issues? What
that.
behavioral issues?
This
This because he's trying to violate my rights. That's where this came from.
irrespective. When we say to other people, "Hey, we have to search you,"
You're violating the rights.
They say, "Okay."
No, it's not the point. The point is the way he came in here and been all sneaky and shit, grabbed my bag, ran
Yeah.
out there and searched
And
it.
I apologize for that.
It don't matter.
And so we
then
can't undo
then you're
that.
kicking me out then.
No, you're leaving against medical advice.
No, it's not. I don't want to leave.
I'm not.
I don't want to leave.
So you have to make a decision that we search you and continue your health care, or you sign and you leave against medical
I'm not
advice.
signing shit, and you're gonna have to drag me out of here by my hair. Tired of you guys fucking. This is ridiculous. This is totally ridiculous, man. Totally ridiculous. You got cops in here don't even know the fuck they're doing.
Would I be able to examine you from head to toe? I'm going to need to anyways.
What do you mean?
How am I going to examine you if you won't have them search your body? How am I going to examine you?
What are you talking about? Why would you be examining my pocket?
Because I have to examine every part of your body.
Since when? And then have them before every time in the house when I had pneumonia.
When you come to the
part
ICU and you're in shock, I have to I have to take off your socks. I have to examine your pulses. I got to examine your clothes. I got to examine every part of your body.
Dude, they didn't have it before when I was in ICU.
Then you have a bad doctor.
Examine my clothes? What's that going to
No,
help?
not examine anything under your clothes.
You should make
Are you wearing pants?
Sweatpants, yeah.
Okay, you're gonna have to remove them.
No, and I'm not.
Mike, this is being
No
difficult.
no other hospital has ever done this.
No other hospital examines a patient when they come into
They don't
the
make me
ICU.
take my pants off and examine me. Never. Ever.
You've been examined by poor providers.
Yeah. Yeah, because examining my legs has everything to do with my pneumonia.
Yeah.
Whatever, dude. You can tell whoever you want to tell that shit to. You ain't telling it to me, and I ain't believing it. So, if you guys want to drag me out of here and do what you got to do what you got to do. It's ready to be heard from my attorney.
I don't know what to do in this situation. So,
So,
if he's refusing
not
for me to
gonna leave-
examine, he's refusing a search.
Well, if
All it is, look,
Yeah, he can just leave
you
AMA.
can just leave. So you're.
If you want to go to another hospital and go to a hospital that doesn't examine you, you could try that.
and all this is because you want to search my pockets.
No, it's because I.
Yes, it is.
They have to legally search you.
No, they do not. They're violating
And
people's
I have
rights.
to examine you, and which requires you to remove articles of clothing so I can
I have
examine you.
never had to remove my pants to get examined, ever, for this pneumonia stuff. I've been through it, but this is the third time. Never once had I removed my pants. What type of weird shit is that? Well, my lung fell down my leg now or something?
So you're saying you waive?
Yeah. So I mean, he's not required to sign that. You guys.
Yeah, that's the kind of place this is.
And if you refuse to leave, you can be placed under arrest.
Oh yeah, ooh, placed on arrest. Yeah, that's not some fucking dumb bitch you are, man.
Okay.
Fuck you.
Okay. So.
This is the type of place it is.
So you realize that
You're
I've been
so
dealing with
bad.
you for
You
2
want to
hours
search me
now.
so bad.
There's
You're
so
willing
many
to
other
stick
calls
to
and
the
other things
hospital.
going on,
What?
and we have so many other calls and things.
Then
going
why
on.
don't you go
The
worry
only
about something that
resources are
matters?
tying up right now.
You are worried about
So
searching
you
me
have a
so
choice.
bad.
You're either going to leave AMA or you're going to let us search. It's your choice.
I told you I'm not going to search shit.
Okay,
So,
so you're leaving AMA.
yep. That's because I'm the type of cop you guys are.
We'll get a wheelchair for you. You might want to start gathering your things.
Yeah, I ain't gathering shit.
Dr. Cucci, do I remove the IV?
So you're gonna end up in jail if you don't do this. So,
Give a fuck.
all right, well, you could do this a little peacefully if you wanted. Your choice.
Not being peaceful. It's about what type of piece of shit people work here.
Sometimes losing is winning. So you're bigger than that.
Yeah. Sometimes when they kick somebody out that's definitely sick because this cop got an ego and wants to search me.
I'm just gonna grab this right here. I got some tape. Pharmacy, can I send some antibiotics too? Sorry, this is just tape.
CVS on Arlington on these smart kids. I can't believe you guys.
CVS on these smart kids.
Did this shit.
Okay. I'll send a 14-day course of augmentin.
Can you bend your arm up?
What? Yeah.
Bend your arm up like this.
No.
I want that cop's name. He's about to get shit screwed up. He don't even know what's coming. You guys have to lose. You guys need to look up in your phones and look what the laws are. These guys are crazy. Man, it's the law, man.
Here.
When you get a second, man, sit down and look up and see what it says. You're gonna be like, oh shit.
Okay. Here's your phone.
Thank you, ma'am.
Okay, I'm gonna take those squeezy things off your legs.
You think I'm just saying all this shit? I'm like just making it up off the top of my head. It's fucking sad.